BMI 29.9mm. Did you know in 2013, the American Medical Association officially recognized obesity as a disease? In India, the percentage of obese individuals is much more than the percentage of undernourished individuals. At this rate, obesity is no less than an epidemic, which is ultimately leading to multiple other medical problems like diabetes, hypertension, sleep apnea, infertility, and many more. Obesity is one of the root causes of cancer too. Apart from all the medical complications that an obese individual faces, a society places an enormous stigma on individuals who are overweight or obese, leading to various psychological issues, including depression. In the current times, it's very easy for everyone to accept that they are suffering from medical problems like diabetes, heart issues, etc. But accepting that they are suffering from obesity is very, very difficult. This is the very fact that has prompted us to do something out of the box to create a reassuring, friendly, and acceptable environment for those who are affected by obesity, and hence the initiative BMI 29.9mm. BMI 29.9mm is a hot from oven initiative, a concept, an idea to ensure that all the verticals of medicine which are impacted due to obesity come together to create a unique and near perfect patient pathway to ensure a holistic approach and treatment of an obese patient. BMI 29.9mm is also aimed at bringing clarity in the minds of people about this concerning topic of obesity, its side effects, its associated medical conditions, and the best long-term scientific solution to this medical problem. I am Dr. Manish Motwani, a bariatric surgeon with Aastha Healthcare and SL Raheja Hospital, Mahim, and also the founder and chief bariatric surgeon at Aastha Bariatrics, which is a center of excellence in metabolic and bariatric surgery. I'll be the host for this unique talk show, BMI 29.9mm. Today, on BMI 29.9mm, we have a noted obstetrician and senior gynecologist from Thane, Dr.Jyoti Saigaonkar. Let's welcome her with a big round of applause on BMI 29.9mm. Dr. Jyoti is a very well-known endoscopist surgeon and an infertility specialist with more than 2 decades of unparalleled experience. Dr. Jyoti Saigaonkar is a director at Dr. Saigaonkar's Hospital and honorary consultant attached with Jupiter Hospital, Kaushalya Medical Foundation Hospital, and Cure Hospitals. She has participated in national and international conferences and has various paper presentations to her credit. Apart from her professional commitment, she has been involved and actively associated with the NGO R-Nisarg Foundation for Environment Conservation. Friends, I have the pleasure of presenting in front of you an affable, amiable, and charming personality, an exceptional gynecologist with marvelous skills, Dr. Jyoti Saigaonkar. Dr. Jyoti, it's an absolute pleasure to have you with us on this talk show, BMI 29.9mm.
Thank you so much, Dr. Manish Motwani, for a very lovely introduction. And I would really would like to thank Aastha Bariatric Care and Dr. Manish for inviting me for this lovely talk show. Thank you so much.
The pleasure is entirely ours. Dr. Jyoti, with your consent, can we proceed with the interview today?
Yes.
So, one of the most commonest problems that you face in your practice is PCOS. Can you just put some light on how are PCOS and obesity interrelated?
Okay. Polycystic ovarian syndrome is a disease condition affecting women of reproductive age group. Now, this disease condition is an hormonal imbalance which is present in these women, especially if they're obese. So what happens is there's a male hormone called as androgen, which is very high in such women, especially when they're obese. And also the insulin hormone, which is required for the carbohydrate metabolism. There's a resistance for this hormone, and hence the metabolism gets disturbed. So you in polycystic ovarian disease and obesity, this hormonal imbalance adds on to the insult.
Okay, that brings a lot of clarity. Okay, this was regarding obesity and PCOS, but could you throw some light also on whether obesity and reproduction are interrelated?
Definitely they are interrelated, because as we very well mentioned that the hormonal imbalance, basically because of high androgens, there is high estrogen in the body of these women of PCOS and obesity, and that leads to an ovulation, or infrequent ovulation as we call it as. And if there is no ovulation, there won't be any pregnancy. So that is how reproduction gets affected. And these women, they have delay in conceiving and even sustaining a healthy pregnancy till term.
Oh, that's okay. Okay, fine. So now the next question from my side is, now we were talking about reproduction, and suppose despite obesity, a pregnant lady conceives.
Okay.
So what are the pregnancy related risks if an obese woman conceives?
Okay, so if an obese woman conceives with a high BMI, she is at a very, very high risk for abortions, preterm delivery, medical complications like diabetes in pregnancy, blood pressure might rise in pregnancy, hypertension as we call it as, and thyroid disorders. Most commonly, hypothyroidism is very common in these obese women. So if we consider all these complications, the maternal and the fetal morbidity and even mortality at times significantly increase in such obese women.
Dr. Jyoti, we spoke about, you gave us a lot of clarity about PCOS, and then how obesity and reproduction are interrelated.
Yeah.
And yes, despite obesity, a patient conceives, there can be pregnancy-related complications.
That's
but
right.
When there is obesity and if it is not going down and the person cannot conceive normally, there are times when you all definitely go in for IVF too.
Definitely.
Friends, IVF means in vitro fertilization, and I would like to tell you that Dr. Jyoti has been a pioneer in infertility. She's having her own center in Thane, and she's a name to reckon with, whether it is in case of laparoscopic surgeries, endoscopic surgeries, infertility. She has made a great name for herself. So Dr. Jyoti, here, now if a lady does not conceive normally, she's having obesity, then the question comes, how do you help her conceive? So you all definitely can go for IUIs and IVFs. There are various methods and treatments that you all follow. But is there a BMI limit for IVF? That means what BMI is too high for IVF?
Yeah. So basically, when we go for this advanced infertility treatments like IUI and in vitro fertilization, we definitely require a BMI which is according to her body mass index, according to her height and weight, So in case if she is obese, we definitely recommend her to lose weight first and then go ahead for this advanced fertility treatments. It is not easy for a woman who has a high BMI, especially more than 32 to 35. Any BMI which is more than 32, 35, it's very difficult for her to conceive in first place. And if she conceives with this kind of BMI, the risk of complications, as we rightly mentioned in the prior question, would increase tenfold, and then the complications might really complicate the whole pregnancy. So definitely, I would strongly recommend her to lose weight, okay, within a definite time span, and then plan for a pregnancy with all these modalities which we could help her with conceive.
So friends, this is an absolute telling statement over here that yes, obesity causes lots of complications in a pregnant woman. Yes. And it can lead to pregnancy-induced hypertension, diabetes, and multiple other problems during delivery too. So Dr. Jyoti, who is a noted gynecologist, she means to say that if there is a limit that you can take, if a BMI up to 32 or 35, yes, they can go ahead with IVF and go ahead with pregnancies. But if it goes beyond that, then definitely she would advise first that the person loses weight and then goes ahead for pregnancy, because there are two benefits out of this, as much as I can understand. One is the chances of pregnancy increase, chances of the treatment increases, and second is that probably the complications go down. I'll give you many of you all might not understand from BMI point of view, but as a bariatric surgeon, we also have one simple calculation that we use during our talks or during our counseling, that if your height, if you calculate your height in centimeters, suppose your height is 155 centimeters. Suppose your height is 155 centimeters. So what should be your ideal weight? If your height is 155 centimeters, then height in centimeters minus 100 is supposed to be your ideal weight. Height in centimeters minus 100 is supposed to be your ideal weight. So if you are 155 centimeters, possibly 55 kg is your ideal weight. So when you are approximately up to 15 to 20 kgs overweight than what your normal weight should be, that is, if you are up to 70 or 75, Dr. Jyoti and other gynecologists and infertility specialists can still try to give you the best treatment and care with their treatment without a weight loss too. But once you go beyond more than 20 kgs overweight, then yes, you first need to lose weight and then go ahead with any other form of treatment which will help you in even making better of that treatment which you're going through. Am I right, Dr. Jyoti?
Yeah. You have raised such a lovely point and you made it so simplified for everybody to understand. And this formula just registers in my mind, and henceforth, this is how we would calculate rather than going into all these equations. Okay, so lovely, lovely. This point is definitely to be stressed on.
Thank you so much. So, Dr. Jyoti, my next question would be, does weight loss after bariatric surgery have a positive impact on pregnancy rates?
Definitely, it has a positive impact on pregnancy rate. As we very well mentioned, the rate of complications, the rate of an ongoing healthy pregnancy, the risk of congenital anomalies in such women, all these definitely go down with the weight loss, which has to be done in the right way, in the right time frame. And moreover, it's not only about pregnancy and reproduction. I strongly feel that as a woman, it's her basic right to have a healthy lifestyle, and her health is our priority. If her health is good, she can reproduce. If her health is not good, she's not a machine. Okay, she's also a human. So it's her basic right to be healthy, to be well balanced at every level, and then plan a pregnancy.
Absolutely. So a very simplified way of saying what Dr. Jyoti has just said, that if you're obese, get your weight down, yes, go ahead for pregnancy. The results of pregnancy are going to be better. Your health is going to be better. Your lifestyle is going to be better. And you should not have negative ideas about bariatric surgery also, because bariatric surgery does not cause any problems for a pregnant woman. It is a very beneficial surgery. Am I right, Dr. Jyoti, if I put it in short?
I would definitely like to mention this point very specifically, that there was a time when we had a lot of negative notions, because of media and because of, I don't know, relatives and so many other things coming onto our ears, that bariatric surgery has a lot of complications. It's a very difficult surgery. Again, the patient tends to put on weight after a specific period of time. But with the advance of all the medical technologies, with excellent bariatric surgeons like you, we are so confident as obstetricians and gynecologists that we are placing our patients in the best hands, and we are going to get the best results out of it. So we have no second thought about it, and definitely my thoughts are very clear about bariatric surgery and weight loss, which would definitely benefit my patients to have a lovely reproductive life and lovely babies ahead. That is something, the happiness which every woman wants to ever experience.
Thank you so much for your kind words, Dr. Jyoti. Dr. Jyoti, what is your personal experience in your patients who are operated for bariatric surgery before fertility treatment? I'll continue that same question in the form of after how many months of surgery do you allow the woman to get pregnant? There are certain reasons, because as bariatric surgeons, we have our own guidelines, and we say that when the person is herself losing some weight, she might not be in the best of condition to give nutrients to the to be born child. So we say you have to stay away from becoming pregnant for at least some time, because suddenly their fertility levels become very high. So what is your personal opinion about pregnancy after bariatric surgery? How much time do you ask them to wait? And what is the special care that you would advise them so that the journey becomes very smooth one post bariatric surgery.
Okay, okay. See, I've been very fortunate to have you as my fellow colleague and my fellow doctor to handle all my good patients who really required bariatric surgery, and they have shown an excellent post-operative follow-up. And most of them whom I've operated with you have conceived within 6 months of my fertility treatment, because once the surgery is done, up to 1 year, up to 8 months to 1 year, we do not recommend the patient to conceive. And during this period of time, we give a good family planning method. Okay, there are a lot of family planning methods. It is tailor-made, and that is how it suits to every couple differently. And we just ask them to avoid pregnancy for that 1 year post-surgery, so that all the nutritional imbalance comes into place. Their ideal BMI is achieved. They start ovulating naturally, and many a times with minimal fertility treatment also, if there are not major factors apart from obesity, they conceive, and they conceive so well, and the whole pregnancy goes so comfortably. And the nutritional part, as you very well mentioned, that the nutritional macronutrients and the micronutrient supplements have to be very well explained to the patient, which either ways in your care post surgery, your dietitian and yourself, you all explain the patient so well. So most of the patients are well read, they are well informed, and they are so well, they understand the importance of diet so well that for me, pregnancy becomes a cakewalk. So I really don't have to, counsel them much, because that job is done at your center so beautifully that I have to just carry forward it and deliver them happily.
Thank you so much. But you all are into the field of creating happy families, giving that child to a family where they have been longing for it. And I truly believe that it's a joint care. No one person can achieve everything, and it's high time that everyone accepts that yes, two various faculties can come together to make the lives of people much more better and much more beautiful. And Dr. Jyoti, it has been a wonderful journey with you too. But and the way you have explained today, I think so it will bring a lot of clarity in the minds of many others, that if you are not getting pregnant and you have obesity, it's not the end of world for you. There are many more things that can be achieved. We also believe that the care of the patient is best done post-surgery also under the gynecologist. And as you're aware, our nutritionists are always in touch with the gynecologist, trying to provide as much support and assistance as much as possible, because we know that your patients consider you all as absolute God, and they would do anything what you all say. And at that point of time, if you all try to put in the best habits of diet in them, they are always going to follow. So this is something that we have also used, and we have been we've had positive achievements with this. So this is a very important point, that yes, two pathis coming together, two faculties coming together and treating a common patient, bring the best of results. But Dr. Jyoti, now that we are coming to the end of this BMI 29.9 talk show today, would you like to give any final word of advice to those young females or middle-aged females who are suffering from obesity and obesity-related gynecological problems? Any final word to them?
Yeah. Dr. Manish, see, this fertility thing is such a, how would I say, such an important issue in our society. Not only it's a taboo, even today, okay, not conceiving at the right time, not having a baby has a lot of stress and desperation in these couples, and many a times I feel that there are so many myths which are surrounded around bariatric surgery and weight loss. This is high time that we realize all these young females are around there, who are like, desperate to get pregnant, and they are not conceiving because of obesity and all other related factors. I would definitely like to say that bariatric surgery is so safe in today's practice, with such good surgeons like Dr. Manish with us, and definitely with the advice of your gynecologist and your bariatric surgeon, you should go ahead with the surgery whenever it is indicated. Okay, which patient is suitable for the surgery, which is not suitable for the surgery, is decided by the it's a teamwork and it's decided by your gynecologist and your bariatric surgeon. But definitely, if you're going to benefit by doing the surgery and weight loss journey to give you a good reproductive outcome, we should definitely recommend the surgery as well as the weight loss program.
That's a lovely advice. Friends, we are from Aastha Bariatrics, and Aastha Bariatrics is the center of excellence in bariatric surgery. And we are amongst the 2 centers in Mumbai and 10 centers across the country who are a center of excellence in metabolic and bariatric surgery. At Aastha, we have been operating patients right from 13 years old to a 75-year-old patient with a phenomenal success rate. And it is because of this joint care and support of all consultants, all orthopedicians, gynecologists, physicians, that we have jointly been able to give such lovely care and treatment to our patients. Dr. Jyoti, your words and ideas have been very transparent with lots of clarity. I'm sure it has enlightened everyone about the association between obesity and infertility. From the talks, it is also evident that weight loss has a huge impact on results of infertility and obstetrics in obese people. Bariatric surgery does have a very strong role to play in weight loss, and I'm sure that the 2 fields of gynecology and bariatric surgery can work hand in hand for the betterment of patients to ensure we give them a better life and much better quality of life.
Definitely, definitely.
Thank you so much for your presence today, Dr. Jyoti. It has been wonderful speaking to you, interacting with you as always, and looking forward to meeting you many more times in future and talking to you more on this. Thank you.
Thank you so much. Thank you. I would definitely like all the audience to take advantage of this bariatric care center, where Dr. Manish Motwani is the director. And definitely for any advice and consultation and counseling, definitely the patient should approach you, or for that matter, they can even approach me and I can guide them accordingly for all the fertility and obesity related issues. Thank you so much for inviting me.
Thank you so much. Thank you. It's a pleasure meeting you.
Same here. Thank you.